Welcome to Adapt NCLEX. If you're preparing to take your NCLEX and you want to know where you stand, I have 85 NCLEX practice questions and answers with high yield NCLEX review and for exam prep. Take these exams, and if you get 65 and above, you're closer to passing the exams. Do you want to know what are the questions? Stick around. Let's get to it. First question. I'm going to go through the questions. I'm going to give you keywords. Take a pen and paper, answer the questions on your own, keep your score, and see how you do. 65 is the challenge. First question, what do you have? This is a prioritization question, right? Which of the following client situation require immediate follow-up? That means something is wrong and the nurse has to do something. The nurse is reviewing laboratory results for 4 clients. What do you think? A client with pyloric stenosis who has BUN of what? 25 and is receiving IV normal saline. A client with sickle cell disease who has a hemoglobin of 8 and receive a blood transfusion. A client with what? Asthma exacerbation who has a WBC of what? 18,000 and is receiving what? IV steroid. A client with what? Anorexia nervosa who has a phosphorus level of 2 and is receiving TPN. Pause the video, pick your answer, think about it, use the B-sharp method, and then pick your answer. The right answer is number 4. Why? A client with anorexia nervosa whose phosphorus is too low and is receiving TPN. This is going to go down more. This can lead to what? Refeeding syndrome. And that patient can go into heart failure. That's a problem. Why is the other answers are wrong? Look at it. Pyloric stenosis. What is the problem? Vomiting. Fine. BUN of 25. It means what? Dehydration. What is going on? Patient is being treated. Receiving IV what? Normal saline. Doing good. Sickle cell disease. Your hemoglobin of 8. You're receiving transfusion. What else do you need? What else do you need? Nothing. A client with asthma exacerbation who has the VVC of what? 18,000 and is receiving steroid. When you're on steroid, your white cells go up. This is due to the fact that the steroid causes different information in terms of migration of immature cells into your blood. The details does not matter. Just know that when you're on steroid, your white cells will go up, and that's what is going on. Therefore, the right answer is number 4. If you see a patient who is anorexic and is receiving TPN and their electrolytes are low, they're more likely to what? As you feed them, they go into refeeding syndrome. So you got to watch for that. That's that patient. EKG, like I said, it's an assimilation. It's a random question. You don't know which is coming. You don't know what is coming next, but you got to pay attention and stay focused like a regular exams. Like I say, it's a mock exams. And this is analyzing a client ECG. Which of the following should the nurse identify as the underlying rhythm? That's all. You click on the rhythm. What do you see? Answer choice: atrial fibrillation, first-degree heart block, ventricular tachycardia, third-degree heart block. Go back to the EKG and look at it carefully. Look at the RR interval. Look for P waves. Look at the distance between the P wave and the QRS. Are they longer or shorter? Is there any drop in it? And that's the way you read EKG. But I can tell you, this patient has a first-degree heart block. Why? Look at the R interval. The R from to R, the uniform. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. They are all uniform. But what is the problem? The PR interval is a problem. The PR interval is longer than usual. And this is the issue that will tell you this is what? First-degree heart block. Your PR interval is more than 3 boxes. PR interval more than 3 boxes. PR interval more than 3 boxes. You can see all the P waves without any problem. It cannot be atrial fibrillation. There's no ventricular problem. It cannot be ventricular tachycardia. It cannot be third-degree heart block because there's no block. That's the key aspect of the question. And this is the way you read EKG. Are they difficult? No, I know you got it because you watch adapting class. Number 3, what do you think? A nurse is assessing a newborn who is 16 hours after birth. Which of the following findings require immediate intervention? Select or apply. Newborn nursing are key for the NCLEX. They love asking you because you have to know them. Which of these require intervention? That means they are not normal. That's all. Central cyanosis, respiratory of 22, acros cyanosis, temperature of 97, heart rate of 128, and grunting during expiration. Pause the video, put down your answer. Let me know what you think. It's a select or apply. Pick your answer and then think about it. I can tell you what are the answers. A, central cyanosis is not something we see. That means there may be hypoxia or cardiac problem. That means the central portion. That means there's blueness, or the patient have blue, or the lips are blue, or chest and everything is blue. That's central cyanosis. Respiratory rate of 22 is abnormal. Why? Kids, newborn should have 30 to 60 respiratory rate. A 22 is too low. That means the baby is hypoxic or getting tired. Remember, 30 to 60 is the normal for them. Anything less than 30, you get to intervene. Acrocyanosis, that means they have blueness in their fingers and toes. Those are expected. You just need to put them to their mommy to warm them up. A temperature of 97 is too low. You want it to be 97.7 above to 99. That is normal for these kids. Heart rate of 128 is normal. 110 to 160 is acceptable. And grunting during expiration is an airway problem. So this is abnormal. These are little things that you have to know when they come to newborn. If you need help, I go to adapting class. I have a bunch of videos on newborn that you can watch that can help you. Next question. A nurse is reviewing 6 pregnant client test results at an outpatient OB clinic, which finding require notification of the air care provider. Select or apply. Non-reactive, non-stress test. Reactive, non-stress test. Negative contraction stress test. Positive contraction stress test. Fetal heart rate increase 15 beats per minute above baseline for 15 seconds within 20 minutes. Late deceleration occurring with more than half of the contraction. I put this question there, and if you have a problem, I want you to pause the video, write everything down, and go master this particular information. But I'll give you the key, because when you see this, it look intimidating, confusing, but it's an easy way to understand that. Do you pick your answer? Like I said, pause the video, then I will give you the explanation. I will give you the concept associated with it, so that when you see it again, you don't run away from it. I can tell you what is the right answer. A is the right answer. D is the right answer. What else? F is the right answer. Those are bad stuff. When we see that, we should report it to the provider. Why? Think about it. Non-stress test means baby, we're seeing if the baby is active and see if they can move around without any stimulation, right? And we're looking for acceleration. That means the baby is not active. Non-reactive is not reacting. We are not giving them any stimulation, but they should be able to accelerate their heart rate. A non-reactive, non-stress test means baby is not doing anything. A reactive is good. Contraction means we stimulate the mommy and we want to see if the baby decelerates. If the baby decelerates, that means what? It's reacting to the contraction. And when they do that, that's a problem. And that's a positive sign. If our mommy contract and the baby doesn't react, it's a negative test. That's good. If the baby decelerates, that's the positive test. That's bad. Write those statements down. And how do I know baby is acceleration? This is it. That's the definition of it. The baby heart rate should go up in what? 15, 20, and 20. That's my clue. Remember that 15, 20, 20. That means 15 beats per minute. It should go up like that, the heart rate. And it should last for what? 15 seconds. And it should occur within 20 minutes. That's the key. Late deceleration, I told you when we see it, it's bad. That means it's a positive contraction test. Those are the keys. When you see it again, record this portion of the video, write everything down. When you see a similar question, apply that strategy. And those are your right answers. And that's why I put it here. Non-stress test, we need 15, 15, 20. That's good. Contraction stress test, negative is good. But if you react to contraction stress test, that's a positive problem. That's a big problem. Another EKG. This is a mock exams. Like I told you, I'm trying to get you to think like the NCLEX. And then this is reviewing the ECG of a client who present with what? Blood pressure over 78/40. Patient is diaphoretic and is confused. Bad problem, right? The priority action should the nurse anticipate is what? This is the EKG you see. What is the rhythm? If you find the rhythm in the patient who is hypotensive, who is diaphoretic, and who is confused, now, do you prepare for immediate defibrillation? Do you give the patient adenosine? Do you prepare for Synchronize Cardioversion or initiate amiodarone infusion? Pause the video, pick your answer in the comment section, and I'll keep track of your answer and let me know. But I can tell you, this is what? Aflutter. If you have Aflutter and you have hypotension, diaphoretic confusion, you are unstable. If you're unstable, we don't defibrillate you, we cardiovert you, because this is a cardioversion EKG, not a defibrillation, because your heart is still working. There's no need to defibrillate a heart that is already working. Therefore, synchronized cardioversion, you don't need to give them any medication. Amiodarone is used for that if they have no what? Hypotension, diaphoretic confusion. Adenosine is using for SVT. This is not SVT. So that's that. EKG. Don't worry about it. Check out that NCLEX for more videos like that. Now, management of care. I put this there so that you can think about it. This is under interdisciplinary care team. These are topics that when you master them, the NCLEX become easy. It's a select and apply. Don't over-select. Which of the following roles delegation should the nurse anticipate? Okay. And nurse attend a staff education on the interdisciplinary care team during the care of a patient who has experienced stroke. Which role is appropriate? Patient has stroke. Let me break down the question. Patient has stroke. And then we have a care team made up of multiple providers. Whose role is appropriate? Case manager is going to coordinate post-hospital care. Physical therapy, do they help with what? ADLs? Occupational therapy, do they work on balance and gait training? Respiratory therapists, do they administer breathing treatment? And speech therapists, do they evaluate and treat for dysphagia? Interdisciplinary care team. What do you think? You pick your answer, keep your score. But I want you to write these concepts down because they are the key. Yes, case manager, coordinate post-hospital care. Physical therapy, think about it. Physical therapy does not use the hand. They are not involved in ADL. They are involved in balance. That's the key. They always will try to trap you. Anything below the elbow, physical therapy does not get involved. Therefore, physical therapy work on balance and gait, not activity of daily living. So that's the swap. It's the occupational therapists that help with the ADL, the fingers, the hands. Respiratory therapy help with breathing therapy, and speech help with evaluating or treatment of aphasia. So those are the three answers, ADA. But the B and C is flipped. So don't forget, physical therapy is using the upper body strength, and then occupational therapy using your hand in terms of what? Activity of daily living. So those are the right answer. You can take a picture of this one. Think about it, and then you can answer the questions. Number 7, mental health, defense mechanism. Mock exams, Can look like that. Your brain keep on going back and forth. Stay focused. Answer the questions in front of you. Don't anticipate anything. A nurse is assessing a client who recently received a terminal diagnosis that will kill him. During interview, the client repeatedly states, "This is the best thing that could happen to me. I'm actually excited about it." Which defense mechanism is the client demonstrating? Denial, projection, reaction formation, rationalization. Think about it. Let me break down the question for you. Patient had a diagnosis of terminal illness. And how you expect them to be crying? They said, "This is the best thing that could have ever happened to me. Actually, I'm very excited." Do you think they are in denial, projection, reaction formation, rationalization? Stop the video, put down your answer, and think about it before you pick it. Are you ready? I know you picked the right answer. And what do you think is the right answer? This is not denial. This is not projection. This is reaction formation. You expect them to be sad, to cry, by the acting opposite to their feeling. That's reaction formation. It's not rationalizing, saying, "This is why it happened to me." No. He's not denying the situation. If he's denying, he will tell you, "No, I don't believe I have cancer." But he said, "Oh, yeah, I love it. Give it to me." That's reaction formation. It's not projecting to anybody. So watch these defense mechanisms. They are usually straightforward, but you have to understand the question before you pick an answer. And that's the explanation there. This Adapt NCLEX Q Bank. I create this question in my Q Bank. I use it for the on-demand and for my crash course. So if you're interested, join Adapt NCLEX Q Bank or crash course, and you get access to this Q Bank. And this is planning interdisciplinary consultation. Which of the following referrals should the nurse anticipate as part of the client's immediate plan of care? Select all that apply. What do you think? What do you think? Case manager for discharge planning, physical therapist for gait and mobility training, occupational therapist for assistance with dressing and feeding, respiratory therapist for routine breathing treatment, and speech pathology for swallowing. What is the problem? This is the patient. The patient is a 72-year-old. He was admitted 12 hours ago with stroke. He has right-sided weakness. He has slurred speech. He's drooling while attempting to drink water. He's coughing during meal. His oxygen saturation is 95%, and he requires assistant transfer from bed. This is the individual. Think about it. 72-year-old with all these conditions. Therefore, if you know what is problem, take a picture of it, think about it. This is the individual. Which of this, okay, which of the following referrals should the nurse anticipate as part of the client immediate plan of care? He said immediate, right now. What are we going to do? You got to base on their condition. They have right-sided weakness. They have slurred speech. They can't drink. When they're drinking, they're drooling. They're coughing. Their saturation is 95% on roommate. Think about it. Not everything you have to select. And they require assistance from transfer. So which of these referral is appropriate right now? He said selected apply, but think about it. Based on that, he said immediate plan of care. I can tell you the right answers are B. Why? Physical therapists will help with gait and mobility transfer because they're having problem moving around. Occupational therapy will also help the patient dress and feed themselves because they're struggling. And the speech therapy need to do swallow steady because the guy is drooling. Why would the respiratory therapist provide treatment? It's already 95%. It does not need treatment for 95% of the roommate. And the case manager, we don't need right now. Patient is in the hospital. We are not ready to discharge. Even though she can do the things, the question said what? Require immediate plan of care. This is the type of next generation question I want you to pay attention to when you get it in interdisciplinary. They're talking about immediate action, no future. So that's the right answer. And this is in the emergency department is assessing for client who is experiencing shock. All of them are experiencing shock. Which of the following client is most consistent with stage 4? Like I said, these are hard questions. If you get 65, you are on top. A client who reports feeling anxious and restless. A client who experiences mild anxiety and tachycardia. A client who is confused and disoriented. A client who is what? Lethargic. These are all critical thinking. They all have shock. But which shock signs should you be concerned that this is the end of shock? Stage 4 is the end of shock. Refractory, coming back. You pick your answer? Did you pick your answer? I know you pick your answer. I keep on saying that because I want you to be actively stopping the video and selecting the answer before I give you the answer away. I can tell you, lethargy is a bad problem because shock progresses. Initially, stage 1 shock, you're a little bit anxious. You go there and restless. You may have some mild anxiety and tachycardia. You get disoriented. Stage 3, that's where you get confused. But in the end, if you get to lethargy, you're not coming back. That's stage 4. So pay attention. Stage 3 is confusion, and stage 4 is lethargy. You are not coming back from it. So that's the right answer. And next is teaching a client about what? Guaifenesin. This is pharmacology. Which instructions should the nurse include? How to answer the question? Pay attention to guaifenesin. Figure out what is guaifenesin. And then don't get trapped. Look at the answer choice and say, I know guaifenesin. Should the patient limit fluid intake while taking the medication? Should they take medication at bedtime only? Should they increase their oral fluid while taking this medication? Should they report dry mouth immediately? Which one should they include? You pick your answer? Guaifenesin is what? It's expectorant. That means you need to get rid of the mucus. You need water to be able to do that. Therefore, limiting your fluid intake and increasing oral fluid intake tell you that there's a clue. This is how you answer question. I see 2 questions, answer choice that are saying opposite. One of them has to be right. Therefore, we are not going to limit our fluid. We're going to increase our fluid because we need the fluid to get rid of what? The mucus. Dry mouth, unexpected finding. And you don't take the medication just at night. And this is reviewing medication for a client with pneumonia who has what? Cough, productive cough. This is built on that. Which medication should the nurse question? I'm going to do the same thing to you as the NCLEX. You answer a question and they give you another one that follows. You think you get it wrong. No, they want to test your stamina, whether you can second guess yourself. The computer is playing trick with your brain. The same thing I'm doing. So patient has productive cough. Which medication should you question? Guaifenesin, acetylcysteine, dextromethorphan, and albuterol. Keyword, productive cough. You should not stop them from coughing. That's the answer choice. If you know which medication will stop them from coughing, that's the buzzword. And I told you, guaifenesin help with getting rid of the mucus. Acetylcysteine, if you know cystic fibrosis, that's what we give it to them to get rid of it. And what? Dextromethorphan, what does it do? It's what? Antitussive. It prevents you from coughing. A productive cough should never be given what? Dextromethorphan, things that will cause them not to cough. Albuterol will help with the airway. Therefore, this is the right answer. The charge nurse in the pediatric unit is assigned care for the following client. Which client should the nurse prioritize? Who should we prioritize? Who need help? Who we need to see? 3-year-old, the temperature 101. He has some diarrhea. A 5-year-old, he has asthma. What? The oxygen saturation is 93 on roommate. A 6-month-old, new rash after he started amoxicillin for otitis media. A 10-year-old, type 1 diabetes, who blood glucose is 140, who need to be seen, who need prioritization, who need help. Otherwise, they get into trouble. And I said, be sharp. Airway problem should be your priority. But what you do, you got to use the be sharp. You ask, is there any breathing issue there? Is electrolyte shock patient there? Sepsis, airway, lethargy, all of them, and then go through. Temperature of 101 is not sepsis. Asthma patient, I know, but it's what? It's doing fine. Saturation of 93. Patient who start amoxicillin may be having what? Anaphylaxis after rash. We need to go and figure out right away. Do we have to do that? Do we have to do that? Do we think we should do that? And a 10-year-old with the type 1 diabetes, you have blood glucose is what? Saturation. His glucose is what? 140. Who is in trouble? Who is in trouble? In prioritization, you have to think. Even though the asthma patient saturation is what? 93 is the one you have to see. The rash, there's nothing. I'm not telling you there's any airway. There's no evidence of anaphylaxis or anything like that. Just a rash, right? This patient is having exacerbation. His saturation is less than 95. We have a problem. You got to make sure they're not going downhill. That's the patient you see. You have to think about this prioritization question carefully. And this is assessing a client with pain. Which assessment finding the nurse should document as a subjective indicator of pain. You see, I underline for you, subjective. How do you describe pain in the subjective way? Grimacing in the face, patient state, my pain is sharp, my heart, the heart rate is 110, and there's guarding at the surgical site. That means when you go to the surgical site, the baby clenched the abdomen. Which one tell you this is subjective indication of pain? Stop the video, pick your answer, and let me know. What do you think? Subjective means the patient is telling you. Objective is you observing. You observe the face is grimacing, it's an objective finding. If the patient tell you something, my pain, that's a subjective. Heart rate is a vital sign, so it's what? Objective. And then when they have pain at the surgical site, based on their reaction, that's the guarding, that's what? Objective finding. And therefore, number B is your right answer. This is the way you go through it. NGN case, right? Short form. And then it's assessing pain in a non-verbal. Patient does not talk. Which of the following finding may indicate the client is experiencing pain? How do I know I'm experiencing pain if I don't talk? It's the same thing we saw, subjective versus objective. What you see, right? Or they can talk to you, but they cannot talk now. So you got to do objective finding to know if the patient is in pain. Heart rate, does that tell you they're in pain? Facial grimacing, does that tell you they're in pain? The blood pressure is elevated. They have relaxed body posture, and they have anxiety or restlessness. Pick one. Is it yes or no? What do you think? Stop the video. Pick your answer. Let me know. Which signs tell you the patient is in pain? The patient has non-verbal mood. He cannot talk. When your heart rate goes up, you are in pain. When you change your face, grimacing, you are in pain. When your blood pressure goes up, you are in pain. When your body is relaxed, I don't think you. And then anxiety, tell me you are in pain. These are little things we can use to figure out that the patient is in pain or not. How are you doing so far? We're on 14. Now we're going to 15. And I know you're doing well. Let's get to it. Same thing, next generation metrics form. I want you to know that these are the things the NCLEX will do to you. I try to make these questions really, really tight and key concept so that you can put it together. Don't run away. When you see these things, they are like select or apply in the box. Select or apply in the box. If you know it, pick it. If you don't guess. And this is assessing a client. Yes, a COPD. Which of the following findings are most consistent with emphysema? Emphysema. What do you think is emphysema? You have to know the difference between emphysema and bronchitis. And that's what this question is asking. Do you see hyperinflated lungs, barrel-shaped chest, excessive mucus production, recent respiratory infection, chronic productive morning cough? What do you think? Which of this is consistent with emphysema? That's all. I can tell you, emphysema, their lung is big, hyperinflated. In the process, they develop barrel-shaped chest. They don't have secretion. They don't have what? Recurrent infection because they don't have secretion. Since they don't have secretion, they're not going to cough. You see what that did? I connect every concept to each other so that you don't have to memorize. They have hair trapping, and therefore their lung is long and big. They have barrel-shaped chest to contain the hair in the lung, but they don't cough. Because they don't cough, they don't have recurrent infection that much, and then they don't have mid-morning cough. That's emphysema. And it's attend a staff education program on safe medication administration. Which of the following action demonstrate correct technique? Select or apply. Like I told you, you can see this question is a little bit, among all the 85, this is a little bit different. That's why I call them NCLEX practice questions and answers, high yield NCLEX review for exam prep, because they are high yield. Fact, if you know them, you're passing the NCLEX. Aim for 65. And put it in the comment and let me know, or email me questions you have issue with. Number 16, what do you think? Which of this is fundamentals, safe medication administration. Administering a sub-Q injection, should you be at 15 degrees? Intramuscular injection, should it be at 45? Intra-dermal injection, should that be at 15? Z-track technique for intramuscular injection? Do you use the what? Vastus lavatus site for intramuscular injection in a 1-year-old? Fundamentals, we apply safe medication administration to answer this question. Do you pick your answer? I know you did. But this you have to know. Subcutaneous injection should not be 15 degrees. It should be what? 45 at minimum, right? If you 90, if you obese, yeah, we go to 90, but this is 45. Intramuscular injection is usually 90, not 45. Therefore, this is wrong. Intradermal, yeah, like a PPD, 15 degrees, 0 to 15. Good. And for intramuscular, you need a Z-track so that it prevents hematoma and all the things the blood can get into ways. So it prevents blood aspiration and also ensure the medication gets to where it's supposed to. For kid, 1-year-old, vascular lavatus is the safest if you're doing intramuscular injection to prevent injury to the nerves. So this is what you need. These are concepts you will see that you should master, and that's the answer thing. And this is the explanation. Okay, little explanation there. And as from the labor and delivery unit is floated to the medical surgical unit. All she does is labor and delivery. Now is the nurse is in a message. Which client is most appropriate? Give them somebody that they know, somebody they can use expertise, somebody does not require specific things that are associated to med-surg that every nurse can do. So what? Fine with the chest pain, awaiting cardiac catheterization. 2 days post cholecystectomy, ready for discharge. 2 patient with type 2 diabetes who need assistance and is ambulating using a glucose monitoring, and a sickle cell patient requiring IV opioid medication, close monitoring. Who will be appropriate for a labor and delivery nurse? Like I said, nobody who needs specialized patient. Diabetes patient is walking, glucose monitoring. Sickle cell require additional information, close monitoring. Cholecystectomy, even though you feel like you got to go, the patient is about to be discharged, the labor and delivery nurse does not know how to discharge this patient. There's specific things you got to teach them to watch for so that they don't come back to the hospital. And cardiac catheterization, when they finish the procedure, there's specific things you have to know. Those are our specialized care for the unit. Too much for labor and delivery nurse. And nursing team consists of what? RN, LPN, and UAP. Which client is appropriate for LPN delegation? LPN is what? MMR most. Most medication. That's what I said. They can do other things. But this is what I use for them. I don't want you to make it too difficult. MMR most. And when I write it, I say what? Most medication, they can monitor, they can reinforce, they can take care of stoma, specialized test, and 2 feet. These are the easiest things they will tell you. And look for the adjective, reinforcing, teaching, all those things, but not initial one. They can reinforce those teaching. So new admission with the chest pain. What do you think? Client awaiting discharge, instruction post-cholecystectomy, and patient has DVT, is on heparin, and client has dysphagia, is scheduled for what? YouTube, gastrostomy 2 feeding. What do you think? Which one is appropriate for who? The LPN. Which one? Who do you think is appropriate? He cannot discharge the patient because the patient is going to go home and require teaching, right? New admission. We can do that. You need assessment. Heparin drip. You need a bunch of calculation. They cannot do it. So this is the right answer. And this is the most appropriate for the LPN. A charge nurse in the labor and delivery unit received report on 4 clients. What is going on? 4 clients. Which client should the nurse assess first? Prioritization, run 1, B sharp, breathing, electrolyte, shock, sepsis, airway, and pain. A client in second stage of labor is contracting every 2 minutes. This is maternity prioritization. A client in first stage of labor with the blood pressure of 160/90. A client in the third stage of labor reporting perineal pain. A client in early stage of labor with leaking clear fluid. Which of these patients do you think we should see first? They are all maternity patients. They are in labor and they're showing certain signs. What do? Stop the video and pay attention. Bring your content regarding maternity. When you see something that you think, that's a problem, should be your right answer. You pick an answer. I can tell you this is our patient. Why? Blood pressure in labor. That's preeclampsia. Look at it, 160/90. Bad problem. We got to make sure they don't get into trouble. They can have preeclampsia. They can have placenta abruption. We are in trouble. Stage 2 labor, you're contracting every 2 minutes, unexpected finding. Third stage of labor, you're going to have pain, right? And in the early stage of labor, your water break. Unless they say there's meconium, yeah. They say clear fluid. Don't make it up. This is all I gave you. Don't change it. The fluid, I know water broke, but it's clear. Nothing to worry about. Case study 20. Question. So far, thank you for sticking around. If this video has helped you so far, you've learned something, just put a like button, subscribe if you've not subscribed, and put a small note, and thank you for watching. Okay, case study. Let's get to it. A 35-year-old client is brought to the emergency department after being rescued from a house fire. What is the respiratory rate? 28. Saturation, 91. Heart rate, 180. Blood pressure, slightly low. This is assessment. Soot around mouth and nose. Do you expect that after a burn? There's hoarseness in the voice. There's saying nasal hair. There's a partial thickness to the chest and the arm. It's been calculated approximately 30. And patient is reporting pain. We have a burn patient. You know how to take care of it? Expect that the NCLEX will give you. That's why I wanted to show you the concept regarding that. If you need more how to calculate this thing, I have a video just released on what? Parkland formula and how to calculate. Check out that NCLEX, and then you master all the concept. Which the nurse has reviewed the clinical data, right? Which finding is most concerning? Hoarse voice, saturation 91, pain 9 out of 10. There's soot around the mouth, heart rate is 110, and there's 30% partial thickness. Which one do you think is concerning? What do you think? Once again, stop the video, pick an answer, and let me know. But I can tell hoarseness, that's airway problem. 91% patient is desaturated. Pain, it's not most concerning. I expect them to have pain. The thing is, even though it's 9 out of 10, it's not going to kill them. So it's not most concerning. What is the problem? Soot around the mouth, that's the airway issue. Heart rate of that, it's okay because they've lost water. It's not concerning to me. But 30% body surface burn is bad problem. It's a truck, right? You think you're pain and should worry about it. But these are things that will not help you that much. The patient is there's a reason why it's most concerning that these are the one that is dangerous, that too much burn to the body. Patient is having airway issues, saturation is 91. He has hoarseness and soot around the mouth. Those are big problems. The nurse recognize the client is at risk of what? When you have burn with 30% and tachycardia and hypotensive, slightly hypotensive, you're most likely going to have what? Hypovolemic shock, not septic shock. Don't get trapped. No cardiogenic shock right away. No neurogenic shock. It's going to be hypovolemic. When you burn, your skin is no more there, no protecting you. So you're losing a lot of water. You go in hypovolemic shock. Now, which of these should you prioritize? Then place the nursing priority in order. Which one? Do you give them opiate pain medication? Pain is what? 9 out of 10, right? You want to give them pain medication. You start IV because the blood pressure is what? 104 and tachycardia. You're going to shock, right? And then what? Prepare for what? Endotracheal intubation. Do you do that? Or apply antibiotic? What do you think? What should you prioritize first? Which one? Place them in order. Of course, the airway, we got to do that. And then we give them what? IV fluid. What? And then we can do, what else do you want to do? Think about what you do. Pain management, then we can apply antibiotic. This is the way we can prioritize them. Which intervention should the nurse anticipate? Therefore, if you know burn patient, what do I expect? Administer 100% oxygen via non-rebreather. Get them 2 large bowl IV. Insert a Foley. They need antibiotic, IV antibiotic prophylactic. Give them lactate ringer using what? Parkland formula. And put your head down. Triangular position. What do you think? Is this what you should expect in the burn patient? Pick your choices. Let me know what you think. And keep your score. Did you pick yours? Yes. We need oxygen. It's a no-brainer, right? Everybody needs oxygen. We're going to start IV so that we can resuscitate the patient. We need to manage how much water is coming out. So, or urine. And therefore, we need a Foley catheter. We don't need an antibiotic. That's a trap. Antibiotic, never pick an antibiotic in the burn patient unless there is a culture that said we have infection. If there is no culture of infection, never pick it. We're going to give them fluid using the Parkland formula, and we don't need to put their head down. That's bad. Now, which intervention in the plan of care should the charge nurse question? That means the nurse is doing something, has created a plan of care. Which one should the charge nurse come in and say, no, what you're doing is the wrong thing? We got a question. Sequential compression device, initiate enteral nutrition, monitor the urine output, break the blisters, and maintain warm room so that the patient can go warm. What do you think? Which one? It's a select apply. Which one the nurse should question? That means the charge nurse should question. That means the inappropriate treatment. What do you think? Of course, we need to put the SCDs on to help with that, to prevent DVT. We need to provide nutrition, and you can give the GI tract feed their mouth, right, rather than TPN. We need to monitor their urine output. These are all good. You should never break the blisters. You're going to create loss of skin and more fluid loss. The room should be warm because they're already being cold. Those, even though they burn, the skin is no more there. They're losing water. They're more colder. That's the key. Now, which finding indicates an effective treatment? That all the things you've done in this burn patient, if the urine output is 35, what do you think? If the carboxyhemoglobin level is 20%, what do you think? If the blood pressure is 80 over 50, what do you think? If the patient has increasing restlessness, what do you think? If the pain decreased to what? 3 out of 10, does that increase indicate effective treatment? What do you think? Stop the video, pick your answer. Let me know. But I want you to master, get 65 in these exams. I know it can be challenging, but I believe in you. Urine output of 35 means we're doing okay. But carboxy hemoglobin is too high. That means patient is still hypoxic. We need to give them more oxygen to blow this out. If blood pressure is 80/50, that's shock. You are not doing well. If you have restlessness, you are not doing well. And if your pain is 3 out of 10, that's a good sign. We are doing well. One question, case study, done. 20 question, what is your score so far? If you're tired, we'll get something to drink and come back. Next question, a client with severe anxiety has been prescribed buspirone. What is that? The client returned to the clinic after 2 weeks and report, I still feel intermittent anxiety. Which action should the nurse take? Instruct the client to stop the medication, notify the provider that the medication is ineffective, reinforce that the medication may take several weeks to achieve full effect, advise the client to take the medication only when feeling anxious. Once again, pause the video, think about it, pick your answer, then play the video. I'm pausing partially for you so that you can select your answer before I give you the right answer. You pick yours. Buspirone is what? Atypical antidepressant. It takes time to work. It can take up to 4 weeks. So if you come in and you still look like you're doing well, but if still your symptoms are there, we need time. We don't have to jump the gun. Therefore, reinforce that the medication will take several weeks to achieve it. Stopping the medication may worsen it. You have rebound anxiety. The provider know that this medication is working because they have improvement. I still feel like intermittent anxiety, that means there's improvement. Allow the medication the full effect. You don't take it until you become anxious. That's why it takes some time to work. So take it before. This is a build up on that. And nurse is reviewing prescription for several clients who has been prescribed buspirone for anxiety. Which of the following prescriptions should the nurse question? I need to question this medication in the patient who has this condition. You cannot take buspirone if you take what? Phenolphthalein, is that true? Buspirone for what? Fluoxetine? Buspirone for a client who is drinking grapefruit juice daily? Buspirone for a client who is prescribed alprazolam? Buspirone for a client who has a history of seizure disorder? Buspirone for a client who currently takes erythromycin? I take the concept that you know, and I create this kind of critical thinking question that they may ask you in drug-drug interaction. If you take buspirone, which medication you should not take? That's all. That's what he's asking. What do you think? Buspirone, I can tell you, buspirone act on serotonins, and the MOAI is phenoxine is a serotonin. It is also increased serotonin. The two of them will become a problem. Fluoxetine is an SSRI, increases serotonin. Buspirone should not be combined with that. You get serotonin syndrome. Grapefruit juice go to the liver, is involved in metabolism of certain medication. One of them is buspirone. If you take it, it's like statin. You can't take statin with grapefruit juice. The same enzyme that break it down is the same thing that will help in the buspirone. Therefore, you can prescribe buspirone, which is atypical anxiolytic. What that patient can also take, in addition to alprazolam, because alprazolam acts right away. Therefore, it should not be cross-reactive. Buspirone has no effect on seizures, but it does have effect on erythromycin. The same enzyme that grapefruit juice affect is the same thing erythromycin affect. These are constant things they may ask you regarding buspirone. It's a very, very important medication used for anxiety, but it's a bus. You can take it without worrying about sedation. That's the right answer. NS is assessing a client with a bipolar disorder in the emergency department. The client reports sleeping 2 hours per night for the past week, and he has lost 10 pounds. So it's not sleeping, he's losing weight in 2 weeks. stating, I don't have time to eat. He does not want to eat. The client is speaking rapidly, right? Pressure speech, appear restless, right? And is unable to remain seated, right? During the assessment, akithesia, keep on moving back and forth. Which action should the nurse expect? High calorie finger food and fluid. Discharge the client with instruction to follow up with outpatient provider. Involuntary admission procedures. Initiate a group therapy. What do you think about this patient condition and what do you want? Is a bipolar in acute mania. He's not eating. He's not taking care of himself. And he's like in acute state, rapid speech, they appear and restless. They can't stay still. Do you give them finger food? Do you discharge them for outpatient? Do you admit them involuntary admission against their will or initiate group therapy? What do you think? Critical thinking. Stop the video. I would like anybody who get to 23 to put down the answer choice and let me know what they selected before I provided the answer choice for number 23. What do you think? Critical thinking. You have to know the definition of involuntary admission. Involuntary admission, you can't take care of yourself, you're suicidal, and you are homicidal. This guy can't take care of himself. Of course, we're going to give them finger food, no group therapy. We cannot send them home, but don't pick finger food in this situation because this patient need to be admitted. Finger food, assume that you can just admit it. This telling you we are in trouble. We need involuntary admission against their will. And this is aware of several clients with gout. He has gout. Which client need further intervention? I was teaching regarding gout. If you have gout, client drink 2 to 3 liters of water a day. Is that okay for that patient? Avoid organ meat. You tell them to avoid organ meat. Avoid protein-rich diet, right? And on allopurinol for small purple rash on the chest. And then the acute flare prescription of colchicine. So this is a patient who has gout, and this is what is going on. If the patient has acute flare, prescribe colchicine. Patient is taking allopurinol and you notice small purple rash. Patient is being told to avoid protein-rich diet and then avoid organ meat and then drink 2 to 3 liters of water a day. Which one need further intervention? That's all. Pick your answer. Let me know. But if you think you have gout, you should hydrate yourself. This is good to prevent crystal formation. Organ meat has a lot of protein diet in it, and therefore you should avoid it. Organ means any organ, your stomach, your liver, those are all organs. You should not eat it because it has high level of protein. What is the problem? You cannot avoid protein. I said protein, no protein. So protein-rich diet, you all need some protein to help your function. Therefore, very, very important. If you're on allopurinol and you see small purple rash, that's Steven Johnson syndrome. It's a sulfur drug. We should intervene. If you have acute flare, yeah, you should not take your allopurinol. You should take colchicine, and that will help with the inflammation because it's an NSAID. 24 question. Now let's get to 25. It's a prioritization regarding 4. You have to know risk factors for 4. And this is assessing several clients on medical surgical unit. Each client has at least one risk factor for 4. So they have a bunch of risk factors for 4. Which clients should the nurse prioritize for immediate fall prevention? They all have risk factors, but who will need to do something right now to prevent them from falling? When you see this kind of question, it's loaded. That means you have to read it carefully. Some people may have more. They're all likely to fall. But there's some people we need to initiate fall right away. Risks, right? 82-year-old with the history of fall, fine? That's a risk factor. He's confused and is attempting to get out of bed without assistant. Remember, he selected apply. We have a 40-year-old who is receiving morphine IV who reports dizziness when he stands or to start it. 68 years old client, newly prescribed furosemide who requires assistance. We got to help them move around to the bathroom. 75-year-old client taking lisinopril will report feeling lightheaded when rising, orthostatic. A 72-year-old with right-sided weakness from a recent stroke who insists on walking independently. You want to walk alone. Cool. All of them may fall. But which one we need to basically figure out an institute for prevention right away before somebody falls down. You pick an answer. You want to know the strategy? Age. Age is always a big factor. Older patient who has history of fall and then is attempting to refuse, get out of bed on your own, that's a problem. It's more likely to fall, and we need to figure out as much as possible. Older patient with a sedation and is reporting dizziness. That's also three things, three strikes. They're going to fall. You see, that's the way I want you to think about a question. Go through them. Patient has furosemide or require assistance to go to the bathroom. There's no, even though there's a risk, there's no immediate need. You just require an assistant to go to the bathroom, right? That's very, very important. 76-year-old, we take lisinopril, the same thing, orthostatic, right? When going out of, rising out of bed, you can tell them slowly get out of bed. And then somebody who has stroke, you really want to walk alone. No, you're going to fall. You already have stroke and you have right-sided weakness. This patient, we need to prevent them from even trying to make an attempt. So that's what the question is asking. Which client should the nurse prioritize for immediate, right now? So pay attention for that kind of language. But this is the way I want you to pay attention to. Confusion, sedation, diuretic, antihypertensive, muscle weakness, advanced stage, history of fall are all conditions that can lead to fall. Schizophrenia. Which of the following findings or interventions should the nurse expect? Select and apply. And this is the reviewing report for a client who has what schizophrenia diagnosis. What you do expect in the patient who has schizophrenia? Disorganized thought, is that okay? Auditory hallucination, they should have flat affect, participation on the group therapy during acute psychosis. If you have acute psychosis, we should send it to group therapy right away. Initiate physical restraint as needed. What? Delusion, they may have delusion, a prescription for Phenaxin. Which of this you should expect in a patient who has schizophrenia? That's psychosis, right? Issue. What do you think? Definition of schizophrenia is positive signs, is disorganized thought process. In addition to hallucination, your flagged affect is what? What do you think? Negative symptoms. Those are the negative symptoms associated with it. They don't need group therapy in the beginning. You should not restrain them. They may have delusion. That's what? Positive symptoms. And they may need antipsychotic. That's Guaifenesin. I create this question to teach you things that sometimes when you put it in a different form, you don't see. But this question alone is loaded. It tells you everything about schizophrenia, what medication they will need, what kind of positive and negative symptoms you should expect in this patient. And nurse is caring for 4 clients in the medical surgical unit who require assistive devices. They require help to walk around, either a walker, a cane, or anything for ambulation. Based on a nurse assessment, which client should be prioritized for fall prevention, right? 4 patients, they all need assistive device. Who is number 1 that we need to pay attention first? Otherwise, they're going to have fall issue. 70, they are older. 70-year-old, so age is not a factor now. Who client, somebody use a cane and report feeling dizzy after taking their morning medication. You take antihypertensive, you're feeling dizzy, it's orthostatic, but you use cane. 70-year-old, he use a walker, is alert, is oriented, is ambulating safely with supervision, right? Is older patient. 65-year-old, is learning to use what? Crutches following ankle surgery and report feeling unsteady, who is more likely to fall down. 70-year-old client is in a wheelchair, is able to propel themselves with brakes locked. What do you think? Who is in trouble to fall right now and get into trouble? You pick your answer? Yes, this guy. C is the one who is likely to fall. Crutches require the use of upper body stability, upper strength. He's feeling unsteady and he has to use his two hands. Cane, walker, and wheelchair are more stable. This one, crutches, is the unstable assistive device because you're more likely to fall. That's why I put it there. You need balance, you need coordination, you need your upper body strength, and that's the one with the highest risk of fall. And then this is scary for a client with multiple hospital admission due to what? Recurrent lung infection. And what is the problem? He has large voluminous stool. What does that tell you? These are what I call buzzwords, right? Like a bee buzzing in your ear. Recurrent lung infection. Does that tell you? Give you a clue. And he has large voluminous stool. Which of the following clinical manifestations should the nurse suspect? Those two words, I'm giving you everything. Recurrent lung infection and large voluminous stool. That means they affect two organs, the lung and the GI tract. So what should you expect? Hyperinflated lung, barrel chest, excessive mucus production, and chronic cough, clubbing of the fingers, thoria, hypertension, growth retardation. What do you think? Which one is consistent with what we should expect? You pick an answer? I know you did. Recurrent lung infection and large voluminous stool. This is consistent with cystic fibrosis. Cystic fibrosis patient have productive cough and chronic mucus production. That's their symptoms that they usually complain about. They have severe hypoxia. They may have clubbing of the fingers. We already see this. They have large voluminous stool. The blood pressure is not going to be high, and they will have growth retardation. Their lung is not going to be inflated or barrel chest. They are not like what? They are not like what? They are not like what? Emphysema patient. They more sound like bronchitis patient. So those are the right answer. And this is assessing a client with iron deficiency anemia. Do you know iron deficiency anemia? I made this question in the bunch of SATA to frustrate you so that you can train yourself when you're taking the NCLEX. When you see so many SATA, you say, oh, adapt NCLEX, train me. Which finding should the nurse suspect? Iron deficiency anemia, fatigue, pallor, glossitis, spoon-shaped nail, and what? Hypertension. There's specific things about condition that if you don't know, I want you to know two things. If you have iron deficiency anemia, what should you expect? Stop the video, pick your answer choice. Let me know what is going on so that you can keep your track. I want you to tell me whether you get 65 or not, because that's our benchmark. But if you have anemia, red blood cells, you get tired easily. And you're going to look pale. Your tongue is going to get inflamed. These are classic. These three things, when it's iron deficiency anemia, that should be the three things coming to your mind. In addition to spoon-shaped nail, blood pressure is not going to be elevated. So that's key. And this is caring for a client with hyperthyroidism. Which finding should the nurse suspect? Hyperthyroidism means what? Everything is going to go what? Up, except your weight. That means all your symptom is hyper, but your weight goes down. Therefore, cold internal lines, no, you're going to have warm internal lines. Weight gain despite decreased appetite. You're not going to gain weight. You're going to have decreased weight. You're going to be tachycardia, not bradycardia. Your skin is going to get warm, and you're going to have diarrhea. This is a key question to test your concept on selected apply, and you can see there's only one answer choice there. If you overselect, you get 0. How are you doing so far? 30 questions down. And if you still with adapt NCLEX, that means you're doing good. That means you supporting the channel. That means you're ready to conquer this test. That means we are going to study more and know the things that is coming. Are you ready? Question 31. A nurse is assessing a client with cirrhosis of the liver. Which of the following findings should the nurse expect? Are you surprised that it is also a SATA? Select or apply is adapt NCLEX home. And therefore, every question we try to put it there so that you can master. If you know what cirrhosis of the liver, which of these should you expect? That's all. Pick your answer, stop the video, and let me know. But don't get trapped. Focus on cirrhosis of the liver. Confusion is not. It's when they go into encephalopathy. Ascites, yeah, you will see it. Spider angioma, you may see it. Hysteresis is when they have encephalopathy. And palmar erythema is their hand. You will see in their hands, you see erythema there. Those are all expected findings in cirrhosis. But when they go encephalopathy, you get confusion, and that's racist. Pay attention to that. Rheumatoid arthritis, select or apply. Like I told you, I'm trying to keep you build you up. Which of the following is consistent with the diagnosis? A nurse is caring for a client with rheumatoid arthritis. It's an arthritis. What kind of arthritis? So it's autoimmune arthritis, and it's called rheumatoid. Which one is consistent with the diagnosis? Select or apply. You don't have to pick everything. There's 6 answer choice there. There may be only one. You pick those you're confident. What do you think? Morning stiffness, classic for rheumatoid. The joint involved is a smaller joint, right? But it's not due to wear and tear. Wear and tear is osteoarthritis. The joint are symmetrical. Both hands, both what? Fingers. It does not involve large joint. It's a small joint. Because of the stiffness, they need to be on a hard mattress when they sleep. And they will need a prescription for immunocompromised states because it's a rheumatoid arthritis. It's autoimmune disease. These are concepts in one question that I would suggest you play it multiple times to know them, so that when you see rheumatoid, you recall that you read that question before. And this is caring for 4 children in residential psychiatry unit. There can be ped psych issues that you have to pay attention to. Which child should the nurse assess first? A child who refuses to eat dinner and skip breakfast. Is that kid is okay? A child pacing in the hallway and yelling bad stuff. A child who cries during group therapy. He cried during group therapy. Is that patient we need to see? A child who attempted to smother a roommate with a pillow. What do you think? These are all kids in a psych unit. They have psychiatric issue. Whose behavior need immediate intervention? You pick an answer. If you attempted to commit suicide on a patient, that's bad problem. All these guys, they have trouble. But this guy, the D is taking the pillow to attempt to what? Smother. That's a suicide. It's not good. Which statement indicate correct understanding of the teaching? A nurse is providing teaching to a client who have type 1 diabetes taking Lispro. It's a fast acting. What do you tell them? Inject the medication 30 to 60 minutes before eating. Lispro work within about 15 minutes of injection. Lispro is usually given once daily. It's a fast acting. How can it be given once daily? I should expect Lispro to last 24 hours, right? What do you think? Based on what I told you, I mentioned one word there. I keep on mentioning it. That's all you need to answer the question. Fast acting. Fast acting, you should not wait. What? 30 to 60 minutes after injection before you eat. 15 minutes is enough. Anything that is fast acting does not need to be given at bedtime. You become hypoglycemia and it doesn't last for 24 hours. And this is monitoring a client with type 1 diabetes. Which of these indicate hyperglycemia? Dry and warm skin, shakiness and tremor, increased thirst and urination, sweating and irritability, cold and clammy. I'm killing the select or apply so that you can be comfortable. What do you think? Which one indicate hyperglycemia? Pick an answer and let me know. And put it down. Calculate your score because you aim in 65. It's a strategy. Hyperglycemia and hypoglycemia. When you're hypo, all your symptoms is going to go up. It's different from hyperglycemia. Hyperglycemia, what is going to go on? They usually try to be cold and clammy and warm and distinct. There's difference between the two. Which one do you think? I can tell you what is the right answer. Pay attention carefully. And next time when you see this question, is this. They usually warm. They're not going to be shaky. They need to get rid of the glucose, so they're going to have thirst and urination. They're not going to be sweaty, and they're not going to be cold and clammy. So they are warm, right? Skin, but if you have hypoglycemia, you'll be cold and clammy. There's a difference between the two. And I want you to know that and use this strategy. Hyperglycemia, they usually what? And hypoglycemia, they usually what? You should learn one side. Hypoglycemia are cold and clammy, they're confused and shaking. By hyperglycemia, I call them they tired, thirsty, increased urination, rapid breathing, dry skin, and warm. That's the difference. Hypo and hyper. One is cold and clammy, and the other one is warm. Pay attention to that. This question is my favorite. I made a YouTube shorts about it, and I put it here. The score was not encouraging, but it's a strategy. Which of the following findings should the nurse recognize as extrapyramidal symptoms? A nurse is monitoring a client who is what? Taking quetiapine. What do you think? Fever, muscle rigidity, autonomic dysfunction, max-like face. I said extrapyramidal symptoms, not NMS. And what are extrapyramidal symptoms? If you watching this video, that means you know adapt NCLEX. And if you know adapt NCLEX, you don't know, you should know extrapyramidal symptoms. It's spelled as adapt with the A, acute dystonia, right? And the another A is what? Akithesia, Parkinsonism, and tardive dyskinesia. So acute dystonia, akithesia, Parkinsonism, and tardive dyskinesia. Another way to learn it is if you see EPS, look for movement disorder. NMS is emergency situation. So I'm looking for emergency signs. What are emergency signs? Fever, emergency sign. Muscle rigidity, emergency sign. Autonomic dysfunction, your blood pressure keep on going up and up, down. Mass-like face is a movement associated with what? Parkinson. Therefore, this is what you're looking for. Parkinsonism, and that is the problem, EPS. And this is caring for a client with asthma, always being prescribed steroid, oral prednisone for recurrent exacerbation. Which of the following adverse effects should the nurse discuss with the client? Select and apply. What are the signs and symptoms associated with the use of steroid? If you know Cushing, that's all. If I give you are asthma patient, I give you steroid, I make you what? Cushing. What are the signs and symptoms of Cushing? That's all. That's what the question is asking. Try to break it down to your level so that you can understand it. What is the side effect of what? Steroid. Or what do you know about Cushing? Signs and symptoms. You pick an answer? I know you did. Steroid, you're not going to be hypoglycemic. You will be what? Hyper, more glucose. You're going to gain weight, not lose weight. You're going to have increased risk of infection, not decrease. Your blood pressure goes up. Your mood is going to change, but your bone density will decrease. This question is a trap to let you know that don't pick over select But to pay attention is critical thinking. You have to bring your content to everyone. You may have seen glucose and everything, but change the information that everybody knows steroid does the opposite way. That's adapting class, make you think critically. And this is caring for a client who has a new ileostomy created yesterday. Which of the following findings require immediate intervention? Best care and comfort. They have ileostomy. What should you expect? High fiber diet is ordered 1 day after surgery for ileostomy. Client avoid looking at the stoma. It's okay. The stoma is producing green liquid stool. A wound care nurse was placed immediately after surgery. Which of this do you think is a bad thing that we need to intervene? Pick your answer. 5 seconds. You pick your answer? Of course, no high fiber diet. The patient may not look at the stoma. It may produce green stool within the wound care concept. But fiber high will cause blockage, not the first 24 hours. And this is caring for a client 12 hours post-operatively after creation of what? Ileostomy. Which of the following require immediate intervention? Same strategy in build 9. The stoma look what? Pale and dusky. The stoma is producing green stool. Patient refused to look at it. And we have high fiber diet. Which one need intervention? 12 hours. It's okay to eat high fiber diet. It's okay to refuse to look at the stoma. It's okay to, if the stoma is producing green liquid stool. It's okay if the stoma appear pale and dusky. This is a critical thinking. I just told you high fiber diet, you should not eat it the first 24 hours. It's 12 hours. But which one is more serious? Pale and dusky. That's the stoma is dying. It's worse than giving them what? Fiber therapy. They will live. But this one, the stoma may die. So that one is more a priority. This is critical thinking. Case study. This is a bow tie. I know you got it. You ready? Let's go. 19-year-old college student is brought to the clinic by a roommate due to what? Progressive weight loss, report intense fear of gaining weight, and exercise what? 2 to 3 hours a day. Eat very small portion and avoid eating in front of others. What is the problem? His BMI is like 16. Heart rate is really low, 48. Blood pressure, low. Temperature in the lower side. What is the problem? Skin is dry. There's fine air noted. And he said, I still need to exercise. I need to lose what? 10 more pounds. That's one word came to your mind after I read it. If not, stop the video, read it again. Don't look even the answers. I want you to keep on making diagnoses before if you look at the answers they've given you. If you do that, you've mastered case study and how to put information, pieces together, identify the cues and put it together. This patient, what do you think? Is this a bulimia patient? Is this anorexic, depression, hyperthyroidism? There's nothing in the case that tells you it's hyperthyroidism, even though they're losing weight, right? It's not telling you their heart rate is high. It's bradycardic. Depression, it may be, but they don't tell you anything. It cannot be bulimia because it does not want to eat. At the same time, his BMI is low. It's less than 80. Therefore, anorexia. Which action should the nurse take? If you know this is anorexia, which is a bow tie patient, should we place them on a cardiac monitor? Do you establish structured meal and supervision? Do you give them methomazole? Do you let them eat alone so that, or let them exercise to prevent anxiety? You give them antidepressant. I'm telling you, we need cardiac monitoring because potassium is going to be low and structured environment. And then what do you monitor for? The electrolytes, right? We got to watch them, daily weights at each time, serum potassium, check your TSH, look for suicide risks, and core body temperature. Which one are you going to do? Which one? What do you think? Which one are you going to pay more attention to? The most important is the daily weight and serum. I know we got to check the temperature. but daily weight and serum of potassium is the best answer. Therefore, this patient monitoring, cardiac monitoring, and establish structured meal plan with supervision and daily weight and potassium. This is how you do case study regarding bow tie. Are you tired? You've got to 40. You've been to 40 answers. That means you're doing great. Almost done. We're getting there. You've done really well. Let's get to it. A nurse is caring for a client diagnosed with adenovirus pneumonia. Which of the following infectious control precaution implemented by the nurse require intervention by the charge nurse? Select and apply. Client in the private room. Client wears surgical mask when entering the room. Nurse wear gloves when providing care. Nurse wear a gown when providing care. Nurse wear an N95 respirator during care. Nurse perform hand hygiene before and after each care. And nurse place surgical mask on the client when outside the private room. Why is this question long and it has a lot of information? To give you everything. After you answer this question, there's a concept that will come out from it that you say, oh, I know now infectious control. First, pick your answer. Then I'll show you how to answer this question. Stop the video, go through each, pick your answer, and then listen to the way I'm going to approach it. The first thing I will do is adenovirus. I'll go back to the adenovirus and I say, what is this? It's what? It's contact and droplet. At the same time, you got to institute standard precautions. So there's three things you would do. Remember, adenovirus is droplet and contact. That's the main, in addition to standard precaution. Therefore, what are you going to do? You say, which one require intervention? Well, you're going to be in the private room. Does that require intervention? No, because you have droplet and contact. The nurse is going to wear surgical mask when entering for the droplets. The nurse wears gloves when providing care. For what? Contact and standard. The nurse wears a gown when providing care. For contact. N95, there's nothing. There is no airborne anywhere. The nurse performs hand hygiene before and after, standard precaution. The nurse places surgical mask on the client when outside the private room. That's what? Droplet. This, you see, bunch of information. If you write your key stuff, you ace it. Thank you for watching and thank you for sticking around. A 23-year-old presented to the emergency department with right lower quadrant pain, vomiting, and fever. What do you think? Appendicitis is suspected. I know this patient has appendicitis. Which of the following the nurse should include in the plan of care? Have you seen a case study like that? Have you seen it before? Bring your content. You say, I have appendicitis. It's a GI problem. Every GI problem, there's certain things you should do. MPO, eating part of the abdomen, initiate IV fluid, prepare for possible appendectomy, broad spectrum antibiotic, and give them laxative so that they can have bowel movement. Pick your answer. Let me know for your score. This is a learning process so that you can learn from it. Every GI problem, there's few things. I'll write quick ones so that you can know. If you need more, check adapting plus content. They're going to be MPO. If you MPO, you get IV fluid. Most of them will get antibiotic, right? If they're vomiting, they get the NG tube. They're going to get pain medication. All these things is like constant thing you see in GI. Therefore, MPO. We don't need an eating pad on the abdomen. We give them IV pain medication with the pain medication. Initiate IV fluid because they MPO. We should prepare for surgery. They will need antibiotic. Nothing to let them have bowel movement. That can cause perforation. And nurse is reviewing several clients' reports. Which of the following client will require provider notification? That means bad staff, we should let them know. A form of prioritization. But when you see this, it may be risk reduction. Client has what? Tuberculosis, reporting the problem. Vision change after he started what? Ethambutol. Is that okay? Should you report to the provider? Client has bronchitis. His oxygen saturation is 91 on room air. What should you do? Asthma is being prescribed metoprolol for hypertension. Patient has AFib. His platelet is what? 100,000, and he's taking heparin. And the patient has tuberculosis. He's taking isoniazid, and now he's prescribed atorvastatin. What did I do? I take the content, I put down contraindication in the same information. Look like prioritization. That is difficult. It's a selected applied prioritization. But if you go through one by one, you can ace it the adapt NCLEX way. I will show you how you can do that. You pick your answer? Let's go. I know you pick yours already. Let's start from the top. Tuberculosis. You have vision changes when you start inhibitor. That's the major side effect. Inhibitor causes optic neuritis. We need to know. Bronchitis. Saturation 91. Well, probably that's where you leave COPD patient. Asthma, metoprolol. Look at it. BAM. BAM is safe in metoprolol, even though it's a beta blocker. It's a selective one, so we good. AFib, your platelet is what? 100. It's less than 150. Now, we get into trouble, right? We get into trouble. And you're on heparin. That's what? Heparin-induced thrombocytopenia. Tuberculosis is taking isoniazid. You should not take statin. That's going to cause liver injury and toxicity of the drug. Therefore, this guy and that need immediate intervention. So those are the guys that need help. Which of these medication the nurse should question in a client with severe decompensated heart failure? If you have heart failure, you should not drop your heart rate anymore or your blood pressure anymore. Anything that will prevent your heart from pumping. Miranol, digoxin, isosorbide mononitrate, and levodopa. All these medication can be used in heart failure. But when you have decompensated, you should avoid beta blocker. Miranol is a nitrate. It helps with preload. Digoxin helps with some contractility and slow down the heart, bromochrome, and the function of the heart. Isosorbide is also nitrate that helps with that. So that one is bad. Which teaching reinforced by the LPN required the RN to intervene? And then is providing district teaching to a client prescribed Phynoxin. Which teaching reinforced? It was reinforced by the LPN required RN to intervene. Use nasal saline drops if you develop a cold. Avoid salami and cheese. Add smoked meat to your diet. Wait 2 weeks after stopping your previous antidepressant before starting this medication. So the LPN is reinforcing this delegation and psych medication at the same time so that you can build your content. When you're reinforcing, you should know what is going on. What is your answer? Which one the nurse should intervene and say, hey, your reinforcement is a bad thing. You should not have smoked meat to your diet, right? Why? Because what? They should avoid anything that is thiamine in it. Nasal saline will help because if you take cold medication, you get what? What do you get? Hypertensive crisis. You should avoid salami and cheese because they have thiamine in it. If you take any other medication, antidepressant, you should wait 2 weeks. But if you still smoke meat while you're on Phynoxin, you develop what? Emergency thiamine. You should avoid it. And this is providing district teaching to a client prescribe what? Fluoxetine. Which teaching reinforced by the LPN require intervention? The same thing. Patient take fluoxetine. LPN is providing what? Reinforcement of teaching. Which one the nurse should intervene? This medication will take about 4 weeks for full effect. You may experience GI upset when on this medication. You may notice a decreased libido. We need to see you back in 3 weeks. Which statement required intervention? Wrong teaching. I can tell you, this is wrong. If you prescribe new antidepressant to a patient, 1 week, at most 2 weeks, in between that, but anything 3 weeks, That's bad. You should see them within 1 to 2 weeks, because if not, they're more likely to commit suicide. 3 weeks is bad. The libido will decrease. They're going to have a GI side effect, and it may take 4 weeks to work. So that's fine. And this is in the ICU, is caring for a client with what? Blood pressure 78/40, heart rate 122, cold and clammy skin. The urine output is 10 ml per hour after heart attack. Which prescribed order should the next question? Amiodarone, tadalafil, dobutamine, dopamine, atropine. There's a bunch of words there. Don't answer the question. This is test taking strategy. Go back again. Go back. Which prescribed order should the next question? That means one of these I need to question. Why? Patient is in the ICU. He had a heart attack. All of the sudden, his blood pressure is 78/40, heart rate 122. His skin is cold and clammy. Urine output is 10. What do you think is going on? This is a critical thinking question. I wrote this question, I changed it. I put a word with these vitals, and I later on changed and put the vitals there. Why? This patient is in cardiogenic shock. You have to recognize that the patient is in cardiogenic shock. And if they are in cardiogenic shock, what things you should not do? They need what? Dobutamine to pump. They need what? Dopamine to pump. But if you give them amiodarone, you're killing them. If you give them what? Tadalafil, you're killing them. Atropine is not going to help them. So they need ionotrope. So dobutamine and dopamine are your right answer. Test taking strategy. And next is providing digital teaching to a client who's ready to go home following a MOAI gastric bypass. Which of the following instructions should the nurse include? What do you think? Eat at least 6 to 8 small meals per day. Mix fluid with solid at each meal. Consume a high, simple carbohydrate diet. Remain upright for at least 30 minutes after eating. What is the question I ask you? MOAI gastric bypass. Look for damping syndrome. If you see damping syndrome, what kind of things should you provide them? You should not be upright after eating. This is gone. You should not consume high carbohydrate diet because you're going to have damping syndrome. You should not mix your solid with your liquid. You should eat small, frequent meal. And that is why you have to eat 6 to 8 times a day. So this is your right answer. And this is caring for a client with rheumatoid arthritis is taking what? Methotrexate. Which of the following vaccination are appropriate for this client? Break the question down. Oral polio vaccine, MMR vaccine, nasal influenza vaccine, Tdap, and varicella. Break down the question. Stop the video. Pick your answer. Let me know. What do you think? What do you think? You pick your answer. A patient has rheumatoid. You take methotrexate. He's going to get vaccine. That means he should not get any live vaccine. Which of this is the live vaccine? That's all. You broke the question down and you get it. Which one is appropriate? Vaccine is not appropriate because it's a live vaccine. Nasal influenza vaccine is also inappropriate. It's a live vaccine. Oral polio vaccine is also a live vaccine. Tetanus is not a live vaccine. Varicella is also a live vaccine. Therefore, the patient can only get Tdap. The rest are all live vaccine. And this is assessing a client in an outpatient psychiatric clinic with suspected diagnosis of depression. Which of the following findings should the nurse expect? Select or apply. Which one should you expect in depression patient? Sleeping disturbances, psychomotor retardation, weight gain, elevated mood, feeling of anhedonia, allogia. What do you think? What should you see in a depressive patient? Pick your answer. Let me know. What are the things you should know about depression? You pick your answer already? Use this SIGI cap. And what is that? Sleeping, it goes up and down. Psychomotor agitation, you're going to gain weight. Your mood is not going to be elevated, it's going to be depressed. Anhedonia, pressure. Allogia, poverty of speech. This is psychosis. Don't let them trap you. Patients who are depressed, it's not like they don't want to speak to anybody or they have poverty of speech. Allogia is specifically for psychosis, unless you have a severe depression. There's nothing there. I said suspected diagnosis of depression. So those are the things you should expect. And this is the key for SIGI cap: sleep, interest, guilt, energy, concentration, appetite, psychomotor retardation, and suicide. Poverty of speech is psychosis. And this is receiving report in a medical surgical unit. Which room assignment is most appropriate for a patient who have HIV and CD4 count of 500 who require admission? Don't get trapped. Don't focus on the HIV too much, otherwise you mix this question. The client has what? Who has MRSA? Client who has scabies? The client who's post-appendectomy? Client who is receiving brachytherapy? This patient has HIV. His CD4 count is 500. Which room would you put it? This is a high yield room assignment question. The NCLEX is going to ask you, what do you think? Where do you place this patient? You pick an answer. Need to go to appendectomy room. Why? Because that's standard precaution. This patient, CD4 count over 200 is fine. So it's like a normal person, even though it has HIV. It's not going to infect anybody. But if you put in MRSA, scabies, and brachytherapy, they're going to get infected. And therefore, that's the place you'll be. And this is assessing several clients with myasthenia gravis. Which client should the nurse see first? What do you think when you prioritize myasthenia gravis? What do you think? Airway is the priority. Incontinence, weakness at night, pitosis, and slurred speech. Which one should you prioritize? Which one? Pick your answer. For all the neurological guys, airway. Slurred speech, when you see it, is airway problem. They were going to have pitosis expected. They're going to have weakness at night. They're going to have incontinence. Ignore it. So far, they have dysarthria, speech problems, swallowing, changing voice. Pick them. That's the priority. Burn question. How should the nurse document the total body surface area of the burn? A nurse receive proof for a client who sustained hot water burn. The entire torso, the front of the left arm, and the back arm. What do you think? The best way to calculate this is to know the Parkland, know how to body surface area. When you draw the individual, the torso, the front is 18 and the back is 18. So the question said the entire torso. That means front and back. And that will give you what? 36. And it said what? The left front of the left leg. So if this is the left leg, the front is 9. So you had 9 to here, you get 45. Now they said the back of the left arm. The left arm is what? 9. The back is divided by 2, you get 4.5. Right? So if you had that to this, what are you going to get? 4.5 and 45, you get 49.5. So this is the right answer. This is how you calculate burn area. If you need more, check out that NCLEX. But this is very, very important. And it is the rule of 9 you can use. But the front and the back of the torso is that. And then the front of the leg, because it's only one, The leg is 18, the front is 9. The back of your arm is half of the 9. And then you can add it together. And this is caring for a client with partial and full thickness burn covering 35% of the total body surface area. Which of the following prescribed intervention regarding infection prevention should the next question? Patient has burn. Prescription, we should question. What? Topical antibiotic agent to the burn wound. Do you use antibiotic? Topical? Administer systemic antibiotic prophylactically to prevent infection. Maintain strict hand hygiene before and after dressing change. Use aseptic technique for dressing change. Patient has a burn, a lot of it, 35%. Which of these you should question? They say apply topical antibiotic to the wound. Give them systemic antibiotic through the IV to prevent infection. Then wash your hand and dressing for change. And then apply aseptic technique for dressing change. What do you think? This is one of the things you should pay attention. We should never give them antibiotic IV unless there is a sign of infection. If you give them, they will develop resistance. When they need it, they will be normal. You can give them topical antibiotic, but no IV antibiotic prophylactically. And this is caring for a client with full thickness burn covering with what? Thick eschar. Which of the following topical medication are appropriate to use in infection prevention? Cifadine, bacitracin, and neomycin. These are all antibiotics we use in what? Burn patient. But the key word is eschar. Which one penetrates in eschar? Mefenide is the one that penetrates eschar. That's the one that penetrated. And this is caring for a client with dyspnea who require continuous oxygen therapy. Which oxygen delivery device should the nurse use to provide precise control amount of oxygen? The question said precise. Which one is good for precise? Nasocannula, simple face mask, ventral mask, non-rebreather. I can tell you, ventral mask is the one that provides precise oxygen delivery device. And this is caring for a group of clients and is assessing for risk factor for developing pneumonia. What are the risk factors for pneumonia? Know this. NCLEX will ask you. Which of the following clients should the nurse recognize a higher risk? HIV patient? Patient is elderly, is not moving and use a worker. He has dysphagia. COPD patient. Patient is post-op and he has surgery through local anesthesia. Patient received influenza vaccine last week. Who is more likely to get sick from pneumonia? Is higher risk. What do you think? Immunocompromised patient? Yes. Elderly, who doesn't move? Yes. If you have dysphagia, you may be aspirating? Yes. If you have COPD? Yes. If you have surgery, but what? Local anesthesia? Yeah, that's good. If you have influenza vaccine, it should be good. So these are the risk factors for pneumonia. Older patient, doesn't move, immunocompromised, bad problem. And this is completing the admission physical assessment on the client with mitral valve insufficiency. Which of the following findings should the nurse expect? When you see this kind of question, pay attention. Mitral valve insufficiency is a prolapse. That means blood reflux. Do you hear loud systolic murmur at the apex? Do you think the blood pressure in both arms will go up? Are you going to see jugular vein distension? Mitral valve is on the left side. And do you see wide pulse pressure? You got to think. It's a hard question if you don't know it, but I will show you strategy to answer it. First, stop the video, pick your answer, and then I'll walk you through how you can wiggle your way. You'll be left with two answers, and you'll be able to pick it. Wide pulse pressure, mitral valve does not control your blood pressure. It's atrial valve, right? If it's aortic stenosis, aortic regurgitation, yeah, your pulse pressures may change. JVD is on the right side, right-sided at the problem. This is on the left side. Elevated blood pressure in your arm, coarctation of the aorta, that's aortic problem. And therefore, this is your answer. That's the easy way to remember them. I love this question. And this is admitting a client with what? Suspected rheumatoid endocarditis. Which laboratory test should the nurse prioritize to confirm the underlying cause of the condition? Troponin, antistreptomycin, O-titer, strep culture, BMP. Think about it again. Go back. Suspected rheumatoid endocarditis. Therefore, the patient has endocarditis from rheumatoid problem. Which one will you prioritize to confirm it? You pick an answer? Don't pick BMP. Please don't pick it. That's heart failure. Don't pick throat culture. Active infection. There is no active infection. The only time rheumatoid endocarditis will be caused by what? Strep. And it happened after the strep has resolved. Therefore, when you do throat culture, it's going to be negative. This is test-taking strategy and critical thinking. What you're going to have is antibody as the body is fighting against the infection in the beginning. And therefore, you get this. Troponin is a heart attack. And this is the rationale for that question. That ASO titer will detect post-infection, previous infection, and that's how you develop endocarditis from rheumatoid. And this is assessing a client diagnosed with pericarditis. That means surrounding of the heart, inflammation. Which of the following should the nurse expect? Mama, sphincter hemorrhage, what? Petechia, friction rub. This is straightforward, simple question. This is to give you more points. But if you don't know it, I want you to read about it. ABC are associated with what? Endocarditis. Friction rub is pericarditis. It's like a clicking sound you hear from the inflammation, and it gets painful, and therefore they lean forward. This is the key. And as a client present to the emergency department 2 hours after sustaining 24-hour, 48% total body surface burn in a house fire. This guy is half of his body is burned. Which the following laboratory findings should the nurse suspect in the early post-burn period? This is a high yield. If you don't know, it's okay. I have a video you can watch on adapted class, but I'm going to explain to you. I want you to take a pen and paper and write everything down so that when you see burn patient, you know electrolyte abnormality, imbalance, acid base. They're going to ask you. But first of all, pick your answer and then see how I'm going to approach it. You pick an answer. This is the burn. When you burn and the skin is gone, there's going to lose all water. You lose water, they get dehydrated. When they get dehydrated, what happens? Electrolyte, hematocrit goes up because there's no water. They have leukocytosis from the inflammation, stress. The cells die. They release potassium. Potassium goes up. It doesn't go down. The stress make glucose goes up. Due to the loss in water, sodium go down. With the loss in water, they develop metabolic acidosis. This is the concept. Never forget that concept. And therefore, what should you expect? You're supposed to expect what? Metabolic acidosis, no alkalosis. Hyponatremia. Hyperglycemia. What is hyperkalemia? Hematocrit goes up and leukocytosis goes up. That's the key. You can take a picture of this, but this is the concept. And then it's evaluating a client diagnosed with what? Anorexia. We've seen it multiple times, but this is the way to get your content back. These are high yield things I told you. They ask NCLEX practice question, NCLEX questions and answers, NCLEX review for what? High yield NCLEX exam prep strategy. And this is evaluating a client diagnosed with what? Anorexia nervosa. Which of the following findings should the nurse expect on what? Assessment. Selected apply. Bradycardia, hypertension, amenorrhea, warm floor skin, denugo, and hyperkalemia. Anorexia is a high yield on the NCLEX. What do you expect on physical exams? I want you to tell me to keep your score. I want you to get this answer right. If not, next time, get it. They're going to be bradycardic. What else? Hypotension. The menses will be destroyed. Pneumonia. The skin is not going to get warm. They're cold. And they have lanugo. Their potassium is low because of purging, right? Therefore, those are the things you expect. And this is the lab work and expect a physical finding you should expect. And this is caring for a client admitted with what? Nephrogenic diabetes insipidus. Which of the following findings should the nurse expect? This is one of the high yield questions are created. But think about it. Nephrogenic diabetes insipidus. You should expect a decreased urine output. You should expect increased urine specific gravity. You should expect no change in urine output with desmopressin administration. You should expect decreased serum osmolarity. Trust me, if you can get 65 above, you're on your way past it. Pick your answer, let me know. Diabetes insipidus, it means there's no ADH. Therefore, what is going to happen? You're going to lose all your water. And therefore what? Decrease urine output? No, it's going to increase. If you lose all your water, urine specific gravity will look like water. It's not going to go up. You see what I'm doing? There's a difference between diabetes insipidus and nephrogenic. Nephrogenic means if you give them ADH, the kidney who said, I don't know what is ADH, it cannot work. Most diabetes insipidus, when you give them desmopressin, it goes away. But this one, there's no urine change. That's cool. Your serum, because you're losing water, specific gravity, osmolarity goes up. And therefore, only for C is the right answer. That is the key concept I want you to know. And this is assessing a client who is demonstrating the defense mechanism of undoing. What is undoing? Which of the following behavior indicate the client using undoing? Which of this is undoing? After yelling at the nurse, the client repeatedly apologizes and bring the nurse a gift. After you yell, now a gift. A client who cheated on the exam begin volunteering at the what? A community center to make up for it. A client insists they never felt hungry after slamming the door. After having hostile thoughts towards a sibling, the client buys them an expensive present. A client blames a co-worker for their own mistakes. When you see psych defense mechanism, forget about all the things they will say because they're confusing, they look the same. Go for the keywords and say, what is undoing? If you define it on your own, the rest is easy. What is undoing? Undoing means undoing. Whatever you did wrong, you're trying to correct it. So which one means I'm going back to fix the problem? Yell at the nurse, now apologizing, buy a gift. That's good. Cheated and went to make it up. You never felt angry, it doesn't care, right? Went back to the sibling, bought them more gifts. Blaming the co-worker, no. So these are all undoing work. And this is performing assessment on the newborn 12 hours after birth. Which of the following findings should the nurse suspect? This is a key concept that you should pay attention to. Heart rate of 130, respiratory of 62 while sleeping, acrocyanosis, passage of meconium, central cyanosis, at circumference 2 centimeters or larger. Which one should you expect? That means normal finding in a newborn. Heart rate 130 is expected finding. Respiratory rate should not be more than 60. If they're sleeping, it should go down. It's 62. We got to pay attention. Acrocyanosis, unexpected finding. You should pass meconium in 24 hours. That's good. Central cyanosis is not good. And the head circumference is always 2 centimeters larger than the chest circumference. Write it down. That's key. These are newborn assessment findings NCLEX love to ask. I try to put it together so that you can master it. And this is assessing the client or report pain. Which statement by the client best reflects the quality of pain? Which one they describe? You see, we talk about pain. Now we want to describe the quality. We've seen some subjective way. The questions can be asked in a different way. The pain started 2 hours ago. Is that quality? My pain feels sharp and stabbing. Is that quality? My pain is 7 out of 10. Is that quality? My pain gets worse when I move. Is that quality? Remember, pain has different things we know about. Location, worsening, quality. Which one indicate quality? What do you think? Sharp and stabbing is describing it. 2 hours is talking about time. 7 out of 10 is intensity. So, and then D is what make it worse, aggravation, what can make it worse. So these are little things I know you know. When you put in the question form, apply it so that you can get your point and move away. This is another key concept you know. A nurse is caring for a client diagnosed with osteoporosis. Which of the following food should the nurse encourage the client to include in their diet? I've told you before, if there's certain questions in the test that everybody is supposed to get it. If you're getting it wrong, go back and learn it. This is one of them. Osteoporosis. What do you think they need? Calcium. Which of these has calcium? That's all. If you don't know, take a picture of it. Go to learn about more food item that is common that contain what? Calcium. Which one? Fortified milk. Calcium. Sardines, good in calcium. White rice, beef, spinach may have calcium in it, but it has oxalate, so it can destroy your calcium. Almonds are very good in calcium. Know this, please. At least these three: almond, salmon, and fortified milk. And Spanish does not contain too much calcium because it has oxalate, so don't pick it. And this is reviewing prescription for a client who is pre-admitted for surgery in 12 hours. Which prescription fit the next question? Perioperative care. Metoprolol, PO, with a sip of water. Levothyroxine, PO. Meloxicam, Mobic, PO for knee pain. And then what? Normal saline, 75 ml per hour. Patient is going to have surgery. Which prescription we should just question? Complication of surgery. Of course, NSAID. Beta blocker, you can take it before surgery. Levothyroxine is a steroid, so sometimes we let them take it, and we give you IV fluid. Mobic is an NSAID. You're going to bleed. I don't like it. And this is caring for a client undergoing continuous bladder irrigation after a TURP. Which task can be safely delegated to a UAP? So patients getting TURP, transurethral resection of the prostate, and now is receiving continuous bladder irrigation, and you're working with the UAP. Which task would you delegate? Measure urine output volume in the drainage bag, clean the catheter insertion site, calculate input and output associated with the drainage and irrigation, assess for bladder spasm, increase the irrigation site, check for kinks in the Foley catheter. Which of this is okay for a UAP? Remember, don't give them anything that requires assessment or judgment. Which one? They can measure the output in the bag. That does not, they just measure it. They can clean the insertion site, but to calculate what is going, what is coming out, that requires judgment from the nurse. To assess for spasm, judgment. To increase the irrigation is also judgment to see if it's okay or we see blood or anything like that. And to check for a kink, also an assessment. So those are the things you should pay attention to. 70. And this is planning care for a client diagnosed with pneumonia. Which of the following action describe planning step of the nursing process? I love this question. I think this is the classic management of care that you see it and you don't know what they're asking. I underline it for you. Planning step of a nursing process. You know there is nursing process. At the planning step, what do you do? Setting a goal for a client to maintain oxygen saturation 94 is a pneumonia patient. Administer or prescribe IV antibiotic. Identify the client as ineffective airway clearance. Develop a plan of care to encourage the client to use incentive spirometer every 2 hours and evaluate if the client oxygen saturation improved after intervention. Use the words. It said planning. What is planning? Planning means you have a goal and you come up with an intervention. That is planning. Come up with the goal and then use the intervention to fix it. So, setting a goal and then intervention, maintaining oxygen saturation, that's planning. If you give them antibiotic, that's implementation. Identifying the client as ineffective airway, what do you mean? Assessment. If you develop the plan to encourage the client to use incentive spirometer, you have a goal and then you have intervention. That's good. Evaluation means evaluation. Therefore, only A and D indicate planning. It's a good question in terms of management of care. And I know you love it because these are key facts that you have to know. And this is the combination of it. A nurse has attended staff education about planning step of nursing process. Which of the following characteristics should the nurse use when developing a care plan? Select and apply. What are the things you should use when you're doing planning? Should it be flexible, individualized, realistic, evidence-based, prioritized, and measurable? I can tell you what. Pick your answer. I'm not going to tell you until you pick your answer. It should be what? Flexible. It should be individualized. Every plan should have a realistic idea. It should be evidence-based, and we should prioritize it. And you have to make sure it's measurable. You can't set a goal that you can measure it. 2 questions left. Are you ready? After this is prioritization. You see it's a hard prioritization, but look at it. And this is receiving report on 5 clients. Who are those? Postpartum client, he has a boogie uterus. Appendicitis patient with a sudden resolution of the pain. The client have IV antibiotic and is wheezing. He has heart failure with a shortness of breath. Patient has myasthenia gravis with ptosis. Arrange them in order. Who do you think you should see first, second, third, fourth, fifth? Multiple patient prioritization. Can you do that? I know you can do that. Pick an answer, let me know. Arrange them 1, 2, 3, and 4, 5. But we know if you get an antibiotic and you're wheezing, you should be the first person we see. And then if you have heart failure with the shortness of breath, you'll be the second person. Who is the third? If you have appendicitis with the sudden resolution, that's the problem. Then we can see the patient who have what? Postpartum hemorrhage, possibly maybe having it. And then myasthenia gravis patient with the ptosis. You say he has boogie uterus, so we have time. But this patient is paying us, he may have had ruptured, it may have abscess, and therefore we got to see them. Now, last question. This is a case study. So that will be the end of the question. 3 case study, I put it to the last so that you can match to them. What is the question? Client present with fatigue, dyspepsia, shortness of breath, diaphoretic when ambulating. That should tell you something. You're walking, you have shortness of breath. When you're going upstairs, all this is a problem. If you take omeprazole, provided a little relief, that means it's no reflux. You report recent diagnosis of angina, that means you have chest pain. You smoke 2 packs per day. What is the problem? Blood pressure, everything is fine. Patient is oriented, lung is clear, there's no murmur, abdomen is fine. He has multiple risk factors: hypertension, hyperlipidemia, diabetes. You take metformin, atorvastatin, aspirin, lisinopril. EKG shows ST elevation. So we have ST elevation, which is bad. That's MI. Procedure, client underwent. So let's see. Now, the nurse has reviewed the clinical data. Which of the following should the nurse be concerned about? Select or apply. What do you think? Pink fluid sputum, bad problem. New X3, bad problem. Why? Because the patient underwent successful cardiac catheterization because of the angina. And therefore, we have this blood pressure. He's on 6 liters of nasal cannula. That's not good. And then what? He's acutely short of breath. He has pink fluid sputum. He has lung crackles. He has no S3 and a JVD, urine output 50 ml for the last 6 hours after we did a cardiac catheterization. Crackles in the lung base is not good. He smoked 2 packs per day. I don't care about it. It's not going to help me. His oxygen saturation is bad. Those are the conditions we should worry about, but no smoking. What do you think has happened to the patient? He has a heart attack. We went and did a cardiac catheterization. All of a sudden, he's showing signs of what? Think about it. Pink fluid sputum, crackles, JVD, new S3. Is this a pulmonary edema? Is it myocardial infarct, acute decompensated heart failure, emboli? What do you think? This is not, he has signs and symptoms of pulmonary edema. We already know he has a heart attack, but this is heart failure. After heart attack, most common is heart failure, and now he's having pulmonary edema, secondary to heart failure. So that should be your priority. Therefore, which order should the nurse include? We're not going to bolus the patient. What do you think? We're going to measure the daily weight. That's good. We're going to check a BMP. We're going to give them furosemide and oxygen. Concept. Which of the following should the nurse include for safe administration? We're giving them furosemide. If I'm giving you furosemide, how do I administer it? Assess your blood pressure before giving you furosemide. Monitor for tinnitus. Measure your electrolyte. Give it IV push. And then administer to the client to take the dose at night. What do you think? Of course, we're going to check your blood pressure. We should monitor for tinnitus and check your electrolyte. If you give it too fast, you cause hearing problem. And then you should not take it at night. You'll be waking up all night. Client was prescribed the following medication and discharge. Match the major side effect of each. Therefore, if I give you furosemide, which one is the major side effect? Hyperkalemia, angioedema, heart block, and hypokalemia. If I give you the digoxin, same thing. I'll give you spironolactone, same thing. Enalapril, what do you think? You stop the video and pick your answer choice. Furosemide is going to cause hypokalemia. The digoxin will cause heart block. Spironolactone causes hyperkalemia, and enalapril causes what? Angioedema. The client is ready for discharge. Which of the following the nurse should include at discharge? What do you think? Call your PCP if your necklace suddenly does not fit anymore. Is that a problem? Who cares if your necklace doesn't fit? Check your pulse 1 full minute before taking enalapril. Transition from a sitting and standing position slowly. Avoid too much banana. Take antiemetic if you have severe nausea. What do you think? He said which one you should include. You should call your doctor. You should call your doctor. Do you think we should do that? I want you to go to the emergency room. Don't call me. Don't call me. Go to the emergency room because that's sudden necklace problem. That's angioedema. You don't need to check your pulse 1 full minute if you're taking an Alopro. You should transition from a sitting position slowly. You should avoid what? Banana. Remember, they're taking what? Spironolactone, enalapril, and furosemide. So they may have too much hyperkalemia on board. Therefore, they should avoid it. You should not take antiemetic when you have nausea. That's the digoxin toxicity. This is our adapting class. 85 questions. We did 3 case study, 2 bow tie, 1 bow tie, and 2. Both of them are 15 questions. And we did 70 questions, total 75 questions. This is NCLEX practice question, NCLEX review question, high yield NCLEX exam prep for your nursing school or NCLEX. If this video helped you, just a small token of comment will help the channel grow. And if you like this video, share. If you have not subscribed, subscribe to Adapt NCLEX. And thank you for making it to 85. That means a lot for sticking around. Good luck, best of luck, and I hope you get 80, more than 65. Thank you. Bye.